Welcome back, everyone, to my channel. We're back in Healthy Dynamics with our monthly interview series, and today I'd like to introduce you to someone who was I just ran into very serendipitously, so very randomly we sort of connected with each other. And how it happened was she checked out one of my podcast interviews, and we connected on Instagram, found a lot in common, and I'll let her introduce herself. So Nina, go ahead, tell us a little bit about yourself.
Hi, so my name is Nina, and I practiced midwifery in Ontario for the last decade.
Mhm.
And prior to that, I taught English in China as a
Oh,
second
wow.
language. So I knew I always wanted to be a midwife because I really aligned with the model of care, meaning the three aspects of informed choice, choice of birthplace, and continuity of care. So being pregnant and birthing a human into this world is very pivotal for someone. And trying to find the balance of the medical system and the belief in your own body is it's it's a contrast, right? There's the light and there's the dark. And I feel that women are losing the belief in their own bodies and their own ability to have babies because we've kind of maybe normalized birth as sometimes can be risky, which it can be, but given the scenario, it can be very, very lovely.
Hmm. Okay. That's interesting because I'm also aware of the fact that you and I are both child free by choice, which makes this
Mhm.
even more interesting. So, and in some ways, if I'm just imagining myself in your shoes, so you know, I I as a person, I'm not just child free by choice. I'm also antinatalist. So I believe that birth is I add a negative connotation to it, that reproduction is criminal. I say all that. How but you may not be the same person. How do you so this is quite a paradox the way I look at it, so you are um yeah, you are child free by choice, but you're also a midwife. So how did you navigate through this paradox as with these two conflicting beliefs and feelings, and how did that impact on the way that you communicated with your patients?
Yeah, that's a very good question. And I feel like I could spend a lot of time answering that question.
Hmm.
Um, but mainly being child free, I have to acknowledge that there was a part of me that wanted to have children.
Hmm.
And she wanted to be a home, like stay at home mom and raise her children and all of that. But given our society and our life, it just wasn't, I couldn't see it in my future.
Hmm.
And as I went through the program, I met other midwives, and their stories influenced me because other midwives would say, "Don't have children, Nina. It's not fun because you're going to leave them and they're going to be like, oh, you're leaving at my graduation, or you said you would go see this movie with me and you're leaving to go to work. And it's not very fun. And those dynamics in your own personal life can cause a burden. And I've seen those midwives who have three or two or four children, and they're exhausted, they're burnt out, they're conflicted. It's, I have a job to do, my life is on call, and I have a family.
Hmm.
So, but then also, I do have a partner, and we have to have open, honest communication of what we want for our lives
Hmm.
together. And we both decided that perhaps being child free is the way to go for us. And we have our own stories and our own reasonings why.
Hmm.
And we decided to go that way. But as a midwife, I actually enjoyed being child free because I didn't bring any of my personal stories into the narrative.
Hmm.
Because as a student, we have a preceptor, so it would be your teacher or your guide.
Hmm.
And you would watch them communicate with clients and patients or clients, we call them clients.
Hmm.
They would enjoy stories. People enjoy hearing stories, but I
Hmm.
did see their own personal hardships and hurdles be reflected in that story.
Mm-hmm.
When I came in as a belief of, like childbirth is different for everyone. Everyone has a different body, everyone has a different baby, and everyone has different circumstances, especially because birth is a very mind-body connection, right? And surrendering to that energy of contractions or pain and learning how to manage and navigate that. And it can be also a very intimate thing where women have orgasmed during childbirth, right? So you would have to just hold that space for the two, like the mother and the father or the partner, and have that sacred space there for them. So I enjoyed being a child-free mother, or not mother, midwife, but I also did find some resistance in myself when people would ask, "Oh, do you have children?" That was one of the trigger questions for me. So
Okay.
sometimes I would answer just no, no, you guys are my children, that's fine. And other times I would answer, well, I have my own personal medical history that I'm not willing to share.
Okay.
Period, right?
Okay. And that's absolutely valid. But yeah, the way you describe the process is very profound. And I would imagine that that is the case. You mentioned the word trigger just a while ago, and this is something that, when I speak to clients, this is something that I also coach them on. When How do you manage your own personal triggers when you are working with vulnerable patients who may have similar or very different triggers? So what has been your
Hmm.
experience and how you manage that?
It's different for everybody, everybody. And I try to come from a place of just recognizing my own triggers and
Mm-hmm.
putting my personal feelings aside.
Mm-hmm.
And it depends on the relationship you have with your client or your patient, because some people are more open and vulnerable and willing to dive deep into their emotions, while others just have like a wall of protection where they're not interested in opening that wound again. And that's one thing I did love about midwifery is we had 30 to 40-minute appointments. We would talk about everything. We would open up space and room for people to ask questions. But a relationship is a two-way street. If you're not
Yes.
willing to be honest with yourself and your care provider,
Mm.
that communication can be hindered.
Yes. Mm-hmm. And at that point, when you did have clients that were a little bit shut off or possibly quite resistant or distrustful of the healthcare system, we'll get into that in a separate question. How did you sort of earn their trust? What strategies did you incorporate to do that?
You validate their feelings.
Mm-hmm.
You try to ask questions. And if they give you one answers, then that's all they would give. And you
Mm-hmm.
wouldn't really probe anymore unless they were more than willing.
Mm-hmm.
And then I just do my job of informing everything that would happen in the medical system and how would they feel, or how would you like me to advocate for you,
Mm-hmm.
would be the other step. Because as a midwife, sometimes you're the middle person
Mm-hmm.
between the nurse or the obstetrician or anyone else included in your circle of care. So yeah, it's that two-way communication street.
Mm-hmm. Awesome. What gaps and challenges did you witness when midwives communicated with patients, and what made it improve and what held them back?
Mhm. So I worked with a diverse community.
Mm-hmm.
I worked at 3 different hospitals in 3 different communities.
Mm-hmm.
One first community was a lot of immigrant families coming to Canada, which I could resonate with because
Mm-hmm.
my parents were immigrants to Canada. So my first language was Portuguese.
Mm-hmm.
And I know when you're translating a sentence into English,
Yes.
there are a lot of words that are, I call them fluffy, or, or adding extra pronouns and things
Mm-hmm.
that are not included in a different language.
Mm-hmm.
So English sometimes softens the communication,
Mm-hmm.
but when you're trying to translate to someone that has bare minimum English, and I
Mm-hmm.
know how they translate their words,
Mm-hmm.
our communication is a little bit more abrupt or just little simple words
Mm-hmm.
to make it more sense to both of us, right?
Okay. Mm-hmm.
And learning through the medical system, you learn all these technical and scientific words and different jargon and terminology. And
Yes.
then you also have to have that skill to translate it to someone that doesn't have that jargon.
Mm-hmm. Yes.
So that was easy for me for some
Okay.
reason. It was
Okay.
really easy for me to connect
Mm-hmm.
with people that had English as a second language. Sometimes there were husbands or maybe a sister or a mother that would come in with the appointment. Sometimes we had a translator. I had a few women that were deaf, so we would
Okay.
sign, and I knew how to sign my name.
Oh, cool. Okay.
And during COVID, we had to
Mm-hmm.
wear a mask.
Yes.
So
Mm-hmm.
that was difficult,
Of
but
course.
they
Yeah.
came out with face shields. So for our deaf clients, we could have the clear face shield and they would watch our lips.
Mm-hmm. Oh, okay. And
Yeah.
that's how they
So
would interpret that. Wow. Mm-hmm.
yes, because some were they would just watch my mouth and I would talk slowly and pronounce the words and talk with my hands and my body language.
Mm-hmm.
And then I would have their husband or support person translate. Sometimes we had a translator, but you would hopefully trust that they got the message and you would just ask, is there any questions? Do you want me to clarify to make sure that they got the full picture?
Mm-hmm. Wow. So this is something that I never touched on, like in my coaching. Like I never touched on people who are like, I'm slowly getting into things like people with patients who have disabilities, but someone who is deaf and possibly blind never looked into that. So you've sort of given me another idea to explore in a different one. Now,
Yeah.
this segues really well into our next question, which is the fact that you came from an immigrant family, just like I did. So, how did that affect your language learning of English and your career, especially when it came to speaking to your patients? And in many ways, you also mentioned that it was also an advantage when you especially had patients who were also from the same background as you. So,
Mm-hmm.
what was the impact overall?
Mm-hmm. A story that comes to mind
Mm-hmm.
is when patients who spoke a different language would speak together in their own language in front of me. And I don't mind that
Okay.
at all.
Mm-hmm. Mm-hmm.
But I do know some of my colleagues would feel some resistance on that, or
Mm-hmm.
like, oh, why are they talking in that language, like their language, like they're supposed to be talking to me. And I also did work with a large Mennonite population, and their culture is very much a together thing. So they would talk in Low German, and I would say, you don't have to give me an answer
Mm-hmm.
because there's a lot of other factors like religion and family and community they have to consider.
Yes.
But they really respected that. When they would talk, I said, you talk, let me know if you have questions. They would look at each other, nod, and I would just leave that space blank. And I'm comfortable in that space. Well, some other of my colleagues expressed to me that they felt uncomfortable, right?
Okay. Mm-hmm.
So that's one of the things that I really enjoyed, is just that feeling comfortable with being uncomfortable with people expressing in their own language, right? It's the beauty of it.
Yes. Okay. And then, from your perspective, when you mentioned that your first language is Portuguese, and then when you moved to Canada, which is where you're based now, how was your experience of learning a new language, and then how were you perceived as an immigrant amongst an immigrant nurse or midwife amongst your patients and your colleagues, and then how did that impact your communication? Was that an advantage, or did it become a hindrance at certain points?
So I will have to clarify. I was born here in Canada, so I'm
Okay,
first
right.
generation
Mm-hmm.
Canadian.
Okay. Mm-hmm.
But my parents immigrated here when they were 17, 18 in the
Okay.
1970s.
Mm-hmm.
So they ended up carving that courage path and learning about English. So when I was little,
Mm-hmm.
I got broken English
Okay.
from my
Mm-hmm.
family, and then I learned English in school.
Mm-hmm.
So some words, I remember growing up as a child, some words I couldn't remember to translate
Mm-hmm.
into English because I just knew the Portuguese word.
Mm-hmm.
And sometimes I do see that in my communication when I was
Mm-hmm.
working as a midwife, where I would have to pause and be like, hold on, what is that one word? And it would take me some time to think of that English word, but I would say another word and people would still resonate with it.
Okay.
So it did cause a little bit of a barrier, but I
Mm-hmm.
think that really just honed down to the fact that medical professionals are humans too,
Of course, yeah. And
right?
I mention that all the time in my
We're
stuff. Yeah.
just humans. We're here
Yes.
to help other people, and there shouldn't, but there's this power and privilege dynamic between
Okay.
a care provider and a patient,
Mm-hmm.
when really we're just here to serve them and
Yes.
give them the best possible care possible.
Yes. 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 And I do mention that in a lot of my stuff that it is important to open up and show your human side and be vulnerable, and they get confused with there's this overarching definition of what professionalism is, and you and I would know traditionally what professionalism is that you dress a certain way, you say these things, you don't say these things, and whatever, and a whole heap of other factors. But now I think we're moving into a world now where people are want to see more genuine human connections and conversations. So that's even more important now to sort of build that. I mean, was there at any point where you felt you needed to hold back and not show your human side because you felt that your patients who are, I know that when they experience pregnancy and childbirth, they are very, very vulnerable.
Yes.
As was Have there been instances where you've had to sort of have some boundaries about how much you share with your patients so that they don't get too attached or they don't get too codependent on you because they're in a
Absolutely.
vulnerable point? Yeah.
Absolutely.
Mm-hmm.
And I think midwifery blurs that line a little bit between
Okay.
professionalism and, a friend or someone you can rely on.
Mm-hmm.
Um, because we offer services for 24/7. We're
Yes.
available via pager. So there's a lot of anxieties that happen when you're at home with a newborn baby, or you're at home and you're in labor and you just really want to call someone, like call a friend and
Mm-hmm.
talk.
Mm-hmm.
And I have met some beautiful souls out there, and some of them are just great, where, they're from a low socioeconomic status and
Mm-hmm.
they're on their own and they just need a little bit of help just to make sure that what they're seeing is normal. But at the same time, it's kind of like, okay, like, yep, this is good. I gave you a pamphlet. Please refer to that. And, like, let's try to empower you to find your own resources and be resourceful instead of relying on, I'm going to call my mom.
Okay. Mm-hmm. Yeah. So
So it can blur a little bit, but
mhm.
sometimes it makes that really nice relationship.
Yeah.
With doctors, it's
Mhm.
completely different.
Of course,
So
yeah.
the OBs and the gyns I worked alongside,
Mhm.
they have office hours. You call their
Mhm.
office, period,
Mhm. Mhm.
or you call the hospital and you work with the nurses.
Mhm.
So it creates that separation, that professional boundary where the OB is actually more independent
Mhm.
than another healthcare provider like a midwife.
Mhm. Yeah. Yeah, that is very interesting. Now, I'm just curious, what's the difference between a midwife and a doula? This is just for
Yeah,
my
good
own. Yeah.
question.
Yeah.
Yeah, I love that question. It's
Mhm.
a very common question.
Mhm.
A doula is a support person. So they are
Okay.
like your best friend. You call them when you need them. They attend your birth, but they don't do any clinical care. They're not
Mhm.
integrated into the hospital system.
Mhm.
They're not integrated into the healthcare system. So they can't perform controlled acts. So, like, delivering babies, delivering
Mhm.
placentas,
Mhm.
inserting needles, things like that.
Mhm.
Our education is different.
Mhm.
We go to a 4-year undergraduate degree of
Mhm.
a Bachelor of Science in midwifery, while they have some a training. I'm not even sure how long it is, so I can't speak to that, but
Mhm.
it's a different education platform. And we have a regulatory body, we have a college and an association, and we're integrated that way
Mhm.
compared to a doula, which I'm not completely sure.
Mhm. Okay, interesting. One of your recent posts on Instagram that I saw yesterday was the concept of trauma-informed care. Now, I have done interviews in the past for, and I do talk about on my platform, patient care and all of those things all of the time. So, can you just elaborate on what trauma-informed care is and why it's important, and why, in some ways, it's kind of dwindling at this point? So, but where are we not really doing a good job in that space?
Yeah, like in our school of midwifery, we did take social work courses
Mm-hmm.
because we took it's not just medical, we're learning the science and procedures and treatments and the pathology and all of that.
Mm-hmm.
It's really connecting with the psyche, the human, and we all come from a journey. We don't know what that journey is, but in birth and becoming a mother, you go through a lot of that journey, especially in the postpartum, where we want to ensure that we recognize signs of any mental health concerns like depression,
Mm-hmm.
anxiety,
Mm-hmm.
or anything like that.
Mm-hmm.
So, trauma-informed care is basically allowing support and allowing validation and allowing a space for the recipient speaking
Mm-hmm.
to you that it is safe to talk.
Mm-hmm.
It is safe to feel your emotions
Mm-hmm.
because sometimes in a society we are maybe not conditioned to talk about our emotions, or you need to toughen up, or like, don't talk about it, get over it. And it's very brushed under the rug.
Yes.
Well, if you were trauma informed, you would say things like, oh, I stand by you. I hear what you're saying, but I can't totally understand what you're saying, but can you
Mm-hmm.
tell me more? So it's inviting a space
Mm-hmm.
for people to open up. And some people do, and some people don't.
Yes. Yeah. And I think also because I did an interview with Margaret a couple of months ago on this channel, and we talked a lot about trauma in general. So when you talk about trauma informed care, do you incorporate just birth or pregnancy related trauma, or trauma overall?
Trauma overall. People come from many different walks of life.
Mm-hmm.
And specifically in high stress jobs, say I'm caring for another healthcare profession,
Yes.
personnel, we see it all. We've seen the good, the bad, the ugly, and sometimes the ugly really sticks
Yes.
because we are just forced to work, manage the ugly, and then boom, another case is here.
Yes.
So sometimes we don't have time to process, even though we do try our best on the floor to kind of huddle, debrief. Is everyone okay? Do we want to talk over what
Mm.
happened, how you're feeling? Sometimes there's just not space for that,
Yes.
especially if
100%.
we're understaffed, or
Mm-hmm.
especially if things are coming in. And so we end up shoving it to the side
Mm-hmm.
and then not experiencing those emotions, not validating those emotions were scary. And I was nervous, or I was concerned about someone's well-being, or, I did a good job, or she did a good job. I'm so glad we worked well as a team. And that validation of being in a nice workplace environment, of recognizing everyone's strengths and weaknesses and supporting and empowering each other to work well
Yes.
cohesively,
Yes.
is not there in healthcare. Not all the time. Sometimes it is, but we
Mm.
really lack that space, especially right
Absolutely.
after an event, because we're just like, okay, on to the next case.
Absolutely. Yeah. I mean, when I did my time in healthcare, even though it was on the phone, it was very similar. Like, you would have a long conversation. It was very procedural, that you say this, you say this, you it was because it wasn't a clerical role. So you say this, you say this, and you just can go through the whole motions. And
Mhm.
sometimes, especially when you have a patient that is quite elderly, and this is what I experienced a lot of the time. So they were elderly, and you had to repeat the same thing over and over again. and
Yes.
or you had someone who was, you know, very, very on the other hand, on the other end, who was very, very distressed, and you have to go through safety questions with them, even though they just want to get things over and done with. You know, for
Mhm.
me, I had to move on to the next interaction straight away, like within a month, within a minute's time. It didn't give me
Mhm.
time to process, and it was exhausting, and which beautifully connects well to the next question on burnout, which is what you speak a lot about on your channel, which
Yeah.
is on the burnout and exploitation of healthcare workers. So, could you
Yeah.
elaborate on that and tell us if you experienced that at one point, and now why do you advocate for it so much?
Yeah. Yeah. So yes and yes. So I
Mm-hmm.
like to say that burnout really focuses on someone's feelings,
Mm-hmm.
while exploitation focuses on business practice and cultural practices.
Yes.
So I think burnout is real because we all have, oh, is the sun not cooperating? There we go. I think burnout is pretty real because we all have feelings. We are all humans. And when you
Mm-hmm.
work in healthcare, it's a human job.
Absolutely. Yes.
And the exploitation is the business practice, the systems. Is there
Mm-hmm.
enough space for provider wellness? Is there
Mm-hmm.
enough time, adequate time for rest and recuperation? Are
Mm-hmm.
you providing healthy work dynamics with your colleagues? How are your conversations with your colleagues?
Mm-hmm.
And I really was attracted to midwifery because I was hoping I could be a business owner and I could influence some change into certain hospitals and create a ripple effect that way.
Mm-hmm.
And I learned more and more about the business structure and the payment fee. And then I asked questions and I
Mm-hmm.
found out that there was some exploiting on newer midwives where certain fees weren't paid to that particular person and were
Mm-hmm.
billed under someone else.
Right.
So when I found that out, I spoke my truth and I was shown the door.
Wow.
So, and this just didn't happen once. I
Mm-hmm.
tried two more times, and it was okay. It's not just like a single occurrence. This is
Mm-hmm.
a systemic
Problem.
power and control and like a mindset of, there's scarcity. There is no scarcity. We're all here to help other people.
Mm-hmm.
And I think it attributes to that burnout where we're so exhausted that we have this defense mechanism where
Yes.
we're just trying to survive.
Mm-hmm.
And we do what's best to survive.
Mm-hmm.
And it's kind of creating a box.
Mm-hmm.
But we need to start poking holes through the box and communicating with our colleagues and communicating with our shareholders and our stakeholders, saying that this is not okay. This is affecting public health care. This is
Yes.
affecting not only us as
Mm-hmm.
providers,
Mm-hmm.
but the people that we serve.
Mm-hmm.
So yeah, I can go on.
Yeah. Yes. We've got 10 minutes. Go on as much as you can.
So that exploitation, and it's kind of like sometimes it takes you a moment to realize, like I've
Mm-hmm.
removed myself from midwifery and reflecting on my documentation that I have, the conversations I had, and speaking with other midwives that have left and their hurdles. And it's a reoccurring theme. And now I'm connecting with other physicians, and it's a reoccurring theme for them as well, where there's no good structural system because
Mm-hmm.
it's also based on capitalism, right? Just
Yes.
in and out, in and out, in and out.
Mm-hmm.
And really, healthcare should be holistic.
Absolutely. Mm-hmm.
Mental health is really coming up, and it's because we're disregarding the mental health
Mm-hmm.
treatments. And
Mm-hmm.
you go to your family physician and you're experiencing something and they put you on medication when
Oh, yeah.
really we're like,
Mm-hmm.
okay, let's go to the root of this. What's
Yes.
your work life? What do you do to bring up your energy? Are you walking? Are you exercising? There are natural ways to boost your energy.
Mm-hmm.
But sometimes when you're working on call, like I did 24/7,
Mm-hmm.
and sometimes you just don't have that space to yourself where you know that this is me time,
Yes.
completely undisturbed,
Mm-hmm.
where you're not 1 foot in the door and 1 foot out of the door.
Mm-hmm.
And same with sleep, because I'm on
Yes.
call. I have my phone
24/7.
right next to me. Yep. And
Mm-hmm.
you want to make sure you don't miss it. So you
Mm-hmm.
build that anxiety and all of that. So I think it's really trying to get creative, find
Mm-hmm.
solutions on how to better serve the provider
Mm-hmm.
and better serve the patient, and
Yes.
incorporating all those holistic aspects, because
Mm-hmm.
naturopaths are doing a great job at it.
Mm-hmm.
And it's the physicians where it's kind of like in the medical system and you get pushed in and get pushed out. So if we could incorporate a collaboration of all
Yes.
different healthcare providers where you refer and it's covered, like in Canada, we have universal healthcare coverage for most
Yes.
things.
Mm-hmm.
But yeah, it's just those ideas and brainstorming with correct people. So I have lots.
Yeah, awesome. And at the moment, are you still in midwifery or have you changed careers?
Change careers out. Yeah.
All right. So what are you doing at the moment?
So right now I'm in network affiliate marketing, and
Yeah.
I work for a company called Enagic where we sell medical grade water ionizers,
Okay.
which I drink all the time.
Okay.
And it has helped my health, especially my digestive system, where I don't need a coffee in the morning to have a bowel movement. So I'm very proud.
Awesome. Very
I
good.
know.
Awesome.
So yeah, just working there. And then I'm doing the backside. So next week I'll be attending the midwifery sustainable rounds, brainstorming with midwives and trying to find ways and solutions to help.
So you are still working with midwives in a different capacity?
In a different capacity, yes.
All right. Excellent. Very good. So yeah. Well, yeah, this was a very, very good conversation that I really enjoyed and was very eye-opening as well. Now, where can people find you on socials or anywhere?
Yeah, so I am on Instagram as Sustainably Nina, because I think being sustainable is the key to holistic wellness. And you can find me on LinkedIn at Nina Couto. And I do have a Facebook account, so you're welcome to add me. And it's just my name, Nina Couto, as well.
Okay, excellent. And well, that wraps up our conversation. Thank you so much, Nina, for your contribution and input. And for the ones who are listening and watching, make sure that you hit the subscribe button and the notification bell to be updated on weekly videos that I post and monthly interviews such as this. So thank you very much for your time and attention, Nina. And for everyone else, I will see you next week.